Introducing the Protectus Safety Syringe, when safety means your life. The Protectus Safety Syringe is easy to use in essentially all routine clinical applications, and once the user is familiar with how the device and its safety features function together, it can be mastered with a few easy-to-follow instructions. Many of the steps indeed employ the same principles and techniques commonly used to give injections with the standard non-safety syringes still in use today. Most importantly, when used properly, the Protectus device protects the user from accidental needle stick injuries. This video provides a step-by-step demonstration of how the Protectus safety syringe is used in routine applications. The first segments are to familiarize the user with the general functionality of the Protectus device, especially operation of the automatic safety features during routine, simple procedures required to safely uncap and recap the needle, change the needle, and fill the syringe with the desired medication. The next segments will demonstrate several techniques for giving routine injections. Finally, we will demonstrate a simple step to permanently lock the Protectus device to prevent any further use prior to disposal into an authorized sharps container. These steps should be practiced until the user develops proficiency for routine use in a clinical setting. We are confident that once the new user becomes thoroughly familiar with the Protectus device, the clear advantages of the device and its overall efficacy in protecting the user from accidental needle sticks will be apparent. First, we want to demonstrate the function and efficacy of the Protectus safety sheath and its temporary lock feature. Let's start by holding the syringe at the flange in the left hand between the thumb and first and second fingers with the needle tip pointed upward. To expose the capped needle, grasp the white cylindrical locking ring in the center of the device with the right thumb and forefinger and pull it down all the way to the flange. Release the locking ring and observe the snap of the protective sheath upward to cover and protect the capped needle. An audible click can be heard, confirming that the protective sheath is locked into place over the needle. Repeat these steps a couple of times to get the feel of the device. Now, while continuing to hold the syringe in the left hand between the thumb and the first and second fingers, invert the syringe, needle tip pointing downward, and tap the rim of the sheath on a tabletop to observe that the protective sheath is indeed in a locked configuration over the needle, thereby protecting the user from the needle. This clearly demonstrates the efficacy of the temporary lock feature of the device. At this juncture, we want to call your attention to the plunger. As you can see, the scale is on the plunger and can be rotated to facilitate visualization of the graduation marks. Notice that the scale is inverted and is easily read at the bottom of the flange. Pushing the plunger in or withdrawing it aligns the graduation marks with the base of the flange to indicate the actual volume of medication inside the barrel of the syringe. Next, we want to demonstrate how to uncap the needle. Again, hold the syringe at the flange in the left hand between the thumb and the first and second fingers with the needle tip pointing upward. Then, with the right hand, grasp the locking ring between the right thumb and forefinger and pull down all the way to the flange to expose the capped needle. At this step, while the rim of the locking ring is touching the flange, grasp and hold the rim of the locking ring with the thumb and the first and second fingers of the left hand to effectively hold the device in one hand with the capped needle fully exposed and pointing upward. Now, with the right thumb and forefinger, grasp the cap covering the needle and simply pull straight up to remove the cap. Put the cap to the side for later use in this demonstration. While still maintaining a grasp of the flange between the left thumb and the first and second fingers, release the locking ring to observe the snap of the protective sheath upward to cover the uncapped needle. Repeat this step a couple of times to clearly observe how the uncapped needle becomes fully covered by the protective sheath each time. As before, invert the syringe containing the uncapped needle and tap the rim of the protective sheath on the tabletop to observe that the protective sheath is clearly in a locked configuration over the exposed needle, thereby protecting the user from any possible needle stick injury. Now we want to demonstrate how to change the needle. Again, hold the syringe at the flange in the left hand between the thumb and the first and second fingers with the needle tip pointing upward. Replace the cap, removed from the needle earlier in this demonstration, by simply dropping it back into this protective sheath over the uncapped needle. Note that no hands or fingers can be pricked or stuck accidentally during this procedure. Again, grasp the locking ring between the right thumb and forefinger and pull all the way down to the flange to expose the loosely capped needle. As before, while continuing to hold the flange, grasp and hold the rim of the locking ring with the thumb and the first/second fingers of the left hand. Press the cap firmly into place over the needle with the index finger of the right hand. An audible click can be heard. While the protective sheath is still retracted, grasp the fully exposed recapped needle between the right thumb and forefinger and twist counterclockwise out of its Luer lock seating. Put the capped needle to the side for further use in this demonstration. Release the locking ring to allow the sheath to snap back into place, but now without the needle. Lay the syringe down on a tray or tabletop. Take a new needle out of its package aseptically. Do not remove the cap, but gently drop the new needle into the sheath, again with the syringe pointing upward. With the syringe still pointing upward, grasp the locking ring between the right thumb and forefinger and pull down all the way to the flange to expose the new needle, not yet secured into its Luer lock seating. With the right hand, twist the new capped needle clockwise into its Luer lock seating until snug. Release the locking ring. Next, we want to demonstrate a couple of techniques for filling the Protectus syringe with medication from a vial. In the left hand, hold the locking ring of the syringe between the thumb and the first and second fingers such that the syringe with the sterile capped needle in place is pointing upward and the graduation marks on the plunger are visible. Rotate the plunger as necessary for full visibility of graduation marks. With the right hand, grasp the end of the plunger between the right thumb placed on the scale side of the plunger stem and the middle finger on the back side of the plunger stem. Then pull the plunger out to the 1 cc mark to fill the syringe with air. The tip of the right forefinger can be used to apply back pressure against the underside of the flange as needed. Uncap the needle, ready for insertion into the medication vial. The first technique for inserting the needle into the medication vial is as follows. While holding the locking ring of syringe in the left hand between the thumb and the first and second fingers with the needle tip pointing upward, place the middle finger of the right hand under the flange on the far side of the plunger stem to be able to apply back pressure, leaving the right thumb and forefinger free. Pull down on the locking ring toward the flange with the left hand and grasp the locking ring with the free thumb and forefinger of the right hand to expose the needle. The left hand is now free to hold the medication vial. With the medication vial inverted in the left hand, the rubber stopper pointing downward, carefully insert the needle into the rubber stopper. While continuing to apply back pressure with the middle finger of the right hand, push the needle all the way in until the rim of the sheath contacts the vial rim. This allows release of the hold on the locking ring by the thumb and forefinger of the right hand. At this stage, the third and fourth fingers of the left hand holding the inverted vial may be conveniently wrapped around the sheath without obscuring the visibility of the needle inside the vial. The left thumb may also be placed at the bottom of the inverted vial to provide additional stability. A second technique for inserting the needle into the medication vial is as follows. Hold the syringe at the flange in the right hand between the thumb and the first and second fingers with the needle tip pointing upward. Pull back on the locking ring with the left hand, then grasp and hold the rim between the right thumb and the first and second fingers to expose the needle. Now take the medication vial in the left hand, the rubber stopper pointing downward, and carefully insert the needle into the rubber stopper. Push all the way in until the rim of the sheath contacts the vial rim. Again, the back pressure on the syringe flange with the right thumb and the first and second fingers holds the rim of the sheath firmly against the vial rim, allowing the release of the hold on the locking ring by the right thumb and the first and second fingers. As before, the third and fourth fingers of the left hand holding the inverted vial may be wrapped around the sheath, and the left thumb may be placed on the bottom of the inverted vial to provide stability. Once the needle has been inserted into the medication vial, inject approximately 1 cc of air into the medication vial by pushing the plunger all the way in, preferably using the right thumb. Back pressure to the underside of the flange for this and subsequent steps can most easily be provided by the thumb, the forefinger, or the middle finger, whichever is most comfortable for the user. The thumb should then be rotated to the butt end of the plunger along with the forefinger and readied for the filling procedure. Then, to fill the syringe with medication, first visually ascertain that the needle tip is below the meniscus of the liquid in the vial. If not, withdraw the needle slightly while continuing to provide back pressure to the underside of the flange. The third and fourth fingers of the left hand holding the inverted vial should be wrapped around the sheath to provide stability. Then withdraw the desired quantity of medication by pulling the plunger out to the corresponding graduation mark on the plunger. This is accomplished mainly with the thumb, while the forefinger is providing back pressure to the underside of the flange. The needle is withdrawn from the vial by simply pulling the syringe away from the vial and allowing the protective sheath to automatically snap back into place in one continuous action. If the injection is not to be administered immediately, replace the cap over the needle and press firmly into place with the right hand. Next, we will demonstrate a couple of techniques for giving an injection. But first, we must sterilize the injection site on the patient using standard operating techniques. Then, we must eliminate any air bubbles that might be present in the syringe as a result of the filling procedure. To do this, hold the syringe in the left hand just below the locking ring, with the needle tip pointing up. Flick the locking ring several times with the middle finger of the right hand to dislodge any small air bubbles within the barrel. Any such bubbles should rise to the top of the liquid in the barrel and accumulate just under the needle base. While continuing to hold the syringe upright, grasp the syringe in the right hand between the first and second fingers at the far end of the locking ring as though holding a cigar. The needle tip and protective sheath are still pointing upward. Place the right thumb on the back side of the flange and pull the locking ring toward the flange with one hand by simply squeezing together. One can visualize any air bubbles just below the needle base. With the left thumb and forefinger, grasp and remove the cap by pulling straight up. Using the thumb of the left hand, depress the plunger slightly to dispense a small amount of liquid and eliminate any air bubbles, and to bring the volume to the exact volume desired, as read on the plunger scale, facing the user. During this procedure, the left forefinger is placed on the far side of the flange and facilitates the depression of the plunger to dispense the small amount of liquid. Release of the locking ring to allow the sheath to cover and protect the uncapped needle. First injection technique will be a two-handed technique. Grasp the syringe with medication in the right hand between the first and second fingers at the far end of the locking ring as though holding a cigar. The needle tip and protective sheath are pointing away from the user. The scale on the plunger is facing away from the user. Place the right thumb on the back side of the flange. Pull the locking ring toward the flange with one hand by simply squeezing together to expose the uncapped needle. Dart the patient at the desired injection site. Apply positive pressure with the right thumb and with the left thumb and forefinger aspirate per standard procedure. Then slowly depress the plunger with the left thumb to administer the desired amount of medication. The first and second fingers of the left hand can be placed on the far side of the flange to facilitate depression of the plunger with the thumb. The scale is again visible to the user during the injection. Then in one continuous movement, withdraw the needle from the injection site and quickly relax the tension of spring between the locking ring and the flange. The right thumb can be slipped off the side of the flange as the needle is being quickly withdrawn from the injection site to allow the tension of the spring to immediately and automatically cover the contaminated needle with the protective sheath. A second two-handed injection technique is as follows. Grasp the syringe at the flange in the right hand between the thumb and the first and second fingers with the needle tip pointing upward. The scale on the plunger should be facing toward the user. With the left hand, pull the locking ring back toward the flange and grasp the rim of the locking ring between the right thumb and the first and second fingers to expose the needle. Dart the patient at the desired injection site and with the left thumb and forefinger, aspirate per standard procedure. Then with the left thumb, depress the plunger slowly to administer the desired amount of medication. The left forefinger can be placed on the distal side of the flange to facilitate depression of the plunger with the thumb. In one continuous movement, withdraw the needle from the injection site and quickly relax the tension of the spring between the locking ring and the flange until the locked position is realized. An audible click can be heard. This allows the contaminated needle to immediately and automatically be covered by the protective sheath. A simple one-handed injection technique is performed as follows. With the left hand, grasp the syringe at the locking ring between the thumb and the first and second fingers with the needle tip pointing downward. The plunger scale can be rotated to be visible to the user. Place the first and second fingers of the right hand on the proximal side of the flange, one on each side of the plunger shaft. And with the left hand, pull the locking ring toward the flange to expose the needle. With the right thumb and the third and fourth fingers, grasp and hold the locking ring at its far end to be able to hold the syringe in the right hand with the needle exposed. While continuing to hold the syringe in this configuration, dart the patient at the desired injection site and aspirate per standard procedure. With the index finger of the right hand, slowly depress the plunger to administer the desired volume of medication. In one continuous movement, withdraw the needle from injection site and quickly relax the tension of the spring between the locking ring and the flange until the locked position is realized. Again, an audible click can be heard. This allows the contaminated needle to be immediately and automatically covered by the protective sheath. Once the user is finished using the device, the permanent lock should be activated. To activate the permanent lock feature of the protective safety syringe, grasp the syringe at the flange between the left thumb and the first and second fingers with the needle tip pointing upward. With the right hand, grasp the locking ring between the thumb and the first and second fingers and twist 1/4 turn counterclockwise until an audible click is heard. In this configuration, the locking ring can no longer be pulled back to expose the needle, and the protective syringe is considered to be permanently locked. After completion of the injection and activation of the permanent lock, simply place the protective syringe in an official sharps container wherever available. If no sharps container is readily available, the permanently locked protective safety syringe becomes in essence its own sharps container. The foregoing steps should be practiced until the user becomes proficient in uncapping and recapping the needle, changing the needle, filling the protective syringe with medication, expiration of any possible air bubbles prior to injection of medication, the injection step itself, and disposal of the syringe using standard techniques. Thank you for your careful attention to the details of this demonstration. The protective safety syringe will soon become your syringe of choice as you continue to provide care to your much valued patients.